Bismillahirrahmanirrahim. My patient, 25 years old, female, married, uneducated, resident of the Liari, presented through OPD with the presenting complaints of generalized pustules all over her body from the last 2 days that was associated with the burning and fever from last 2 days. My patient was in usual state of health around 2 years back when she first noticed burning all over her abdomen, and the itching was first try, and she graded it from 10 out of 10 in severity, whereas the family history of itching was also there, and later on she has developed the red raised lesions over her abdomen. That was that is later on she has developed the pus containing pustules over its surface, and which has gradually dry off, and there was a scale shredded from its surface. She according to the patient, her disease get aggravated after she left her medications. That is, she got intramuscular injections from the local doctor, and she took two intramuscular injections from the last 2 weeks. As she left, she has developed the generalized cercinate lesions over her body that was containing the pustules over it, and with the relative sparing of the eye mucosa and the nasal mucosa. However, the oral and the genital mucosa is also involved in it. She has developed fever with it. Fever was high grade, and that was continuous, and there was no associated sore throat and the burning micturition along with it, or any joint pains. When she has developed the generalized pustules of her body, she get also the swelling of her hands and feet. Along with it, she has developed tetany, and she get admitted to hospital. According to patient, her disease get relieved after getting admitted to hospital. Meanwhile, during this disease, she has also developed similar lesions over her scalp, and however, she has over the scalp, and however, there is also relative sparing of her palms and soles. According to the patient, she the only aggravating factor is the intramuscular injections and the stress factor, and later on she has she has no any history of flaccid blisters over the seborrheic areas, and that was later on followed by the crusting over the scalp and the front of the trunk. She has no she does not give history of the specific pustules in which the pus is on the lower part of the lower part, that is a hypopion sign, and she does not give history of the erythroderma, and along with it she does not give history of the weight loss and lumps and bumps in the body. According to patient, as she was taking intramuscular injections, she has developed she has 1 or 2 episodes of hypertension, and as she get admitted to hospital, she also complaining of the diabetes. However, she does not give history of the any heel pains and the and weight gain. According to the patient, she took a lot of medications, that is the Hakimi medications and the local medications, and as well as topical medications, and however, she does not give history of any immunosuppressant. She was previously taking, or she has not done his biopsy, skin biopsy has not done. And the disease course, she was according to patient, her disease is getting better after getting admitted to hospital, and her past and medical and surgical histories are remarkable. She never get admitted hospital before, and she is not known for any allergies, no history of asthma and tuberculosis and hepatitis B and C. Along with it, she belongs to a poor socioeconomic status, and her social and personal effect is severely affected by this disease. She is even unable to sleep properly, and further, she is a mother of 4 children, and her menstrual cycle is regular. All her she has done SVDs of all the children. Next, on the general physical examination, my patient is well cooperated and comfortable throughout the examination. She is well oriented in time, space, and person. At the time of the examination, her blood pressure is 120/80 and pulse is 86 beats per minute, whereas the respiratory rate is 16 breaths per minute, and she is afebrile. And his cervical group of the lymph nodes and the axillary lymph nodes are not palpable. I have not done the axillary lymph nodes because all the axillas are macerated, and there is macerations, and similarly lakes of the pus is present in the both of the axilla. And her JVP is not raised. Pedal edema is not present, and further the thyroid is not enlarged. On cutaneous examination, there is a generalized red raised cercinate erythematous, red raised cercinate plaques, which are involving which are studded with the pinpoint pustules, and that are present over the bilateral upper limbs, and all over the body, more predominantly the upper body and the flexures, with the relative sparing of the lower limbs, and whereas the hands and feet are also spared. And on the examination of the scalp, all the four quadrants of the scalp is spared, and the hair distribution and texture of the hair is normal. Similarly, patient is not anemic and not jaundiced. And on examination of the oral cavity, she has the mild erosions over her lower lip, labial mucosa, whereas the buccal mucosa, the hard palate is spared. Further, on the examination of the nails, the nail of her right ring finger is having a yellowish discoloration, yellowish and dystrophic, whereas all the nails of the hands and feet are spared. The web spaces are spared. So, whereas on examination of the lower limbs, similarly erythematous raised plaques which are confined to the lower abdomen, lower limb, and in which the flexures are more predominantly involved, that is the popliteal flexures and the inguinal flexures, and similarly the pus containing pustules in the form of the lakes of the pus is present over it. Further, on the systemic inquiry, on the auscultation of the chest, there is a normal vesicular breathing with no added sounds, and the chest expansion is 5 centimeter, whereas on auscultation of the heart, the first and second heart sounds are normal with no added sounds, and there is no hepatospleenomegaly. The liver span is 9 centimeter diameter, and the inguinal group of the lymph nodes are not enlarged. Further, patient can walk easily, and depending upon these history findings and examination findings, my differentials are: number 1, it could be the that is the pustular psoriasis, and number 2, it could be AGEP. Thank you.